Good morning and welcome to the training under exploring the evolving topic of cannabis use in our state. My name is Lawrence Medina. I'm the Executive Director for Rio Grande Alcoholism Treatment Program in Northern New Mexico, serving Northern New Mexico since 1978. I'm also the chairperson for the SABG Independent Peer Review Committee under the Behavioral Health Service Division. And it's a pleasure to have you here. And I'm going to introduce my colleague, Amanda Barela.
Hi, good morning, everybody. Thank you so much for coming to this training. My name is Amanda Barela, and I'm a clinical social worker and a licensed alcohol and drug abuse counselor. I've been on the IPRC now for about 7 years, and I do some work for the public schools, teach at NMSU, and work in outpatient substance abuse. I wanted to provide everyone with a little bit of an overview of the IPRC because a lot of people are like, what is the IPRC? So the Federal Substance Abuse Block Grant is administered to each state through the Substance Abuse and Mental Health Services Administration. So SAMHSA oversees the Substance Abuse Block Grant. The Substance Abuse Block Grant is intended for individuals that are not insured or underinsured. And so agencies can apply for these funds and use it to help pay for clients that are underinsured, have high copays, or don't have insurance. But SAMHSA also, there are regulations that we must follow, and one of them is to set up an independent peer review committee in each state. And so the IPRC mission is to enhance the substance abuse treatment service network throughout the state. And we meet monthly, and our committee is comprised of 9 members statewide. And most of our members work at agencies that are recipients of these grant funds. And in the IPRC, we do site visits throughout the state, throughout the year to the agencies that are receiving funds. And the purpose of the IPRC is so that we can all learn from each other best practices, promising practices. And it really is a wonderful experience to be able to see what other service providers throughout the state are doing. So we really appreciate everyone coming. This training is being put on through the IPRC, through BHSD, the Behavioral Health Services Division. So I wanted to just give a little bit of an introduction why we feel that this training is so important. We chose this training because as providers throughout the state, we have been seeing the impact of medical marijuana on our clients and agencies for many years. And we don't see a lot of trainings out there, right? As a provider, I've often had questions such as, you know, when is it problematic use? When someone has a medical marijuana card, at what point is that problematic? And what do you do? What kind of impacts does this have on different mental health conditions, right? How does medical marijuana intersect with someone's sobriety? And how do we navigate our abstinence-only people and our harm reduction people and our California recovery people, which is what we call people that are sober but still use marijuana? And now we've legalized it statewide, right? And so we have throughout our state lots of people consuming and using marijuana that maybe didn't previously or doing it more so now. And so we really felt like this training would benefit our state to be more responsive to these legislative changes. We want to thank Behavioral Health Services Division, who is our sponsor, and especially Jackie Nielsen, who's a Deputy Director at BHSD, and Cynthia Romero, our fabulous Blanc Grant Coordinator, who helps to oversee and run the IPRC. The last thing that I want to share is there are CEUs for this event, and they will be emailed to you through HUVA. If you don't receive your CEU, please feel free to reach out to us, but I would give it about a week to receive your CEUs. So with no further delay, I'll pass it back over to Lawrence and we can begin our training. But thank you again, everyone, for coming.
Thank you so much, Amanda, down from Las Cruces. I'm here in Taos, New Mexico. As Amanda said, there's been a lot of discussion now that cannabis has been legalized. And as treatment providers for SUD, substance use disorder, we want to stay ahead of it. As we know, in recent times, New Mexico is #1 worst in the nation for alcohol deaths related to alcohol use disorder. And now that cannabis is legal, we look at the addiction side. And and I would strongly recommend that you speak with your legislators and elected officials about 2 areas that we feel are important related to cannabis. But when we look at the percentage of individuals that have addictive behavior or have had issues with addiction in the past, that it wasn't clear in the bill for substance use disorder, or better yet, cannabis use disorder treatment, #1, and #2, education. And we feel this is one of the first cannabis trainings to inform professionals, stakeholders, elected officials, and the general public on cannabis use, but also the good, the bad, and the ugly. Aside from the politics and the making of money, we do have an issue of substance use disorder here in New Mexico. And a lot of times when poly users, that's, individuals with addiction that use multiple drugs, that that this could be a pathway to relapse, pathway back into meth, crack, heroin. And so we want to stay ahead of it. We're hoping this contributes to being proactive to addressing the medicinal use of cannabis and the way it's supposed to be used, just like alcohol is legal, but also that we want to advocate for those with addiction, that addiction is a disease and not a moral failing, and that we can do some sorts of interventions. Our speakers today, we're very excited to have some great speakers, some from the state of New Mexico that we'll be introducing. And we have a group from New Jersey that talks about, from a national perspective, what are other states doing, especially with individuals within the judicial system. A large part of Medicaid, behavioral health services, there's a lot of folks in New Mexico receiving behavioral health services that are within the judicial system. So we hope that this could be not only educational, but plant some seeds for advocacy to address the issue of substance use disorder in our state. With that, I'm going to be turning it over to Dr. Neil Bowen. Unfortunately, was not able to make it. However, we have the Deputy Director of Clinical Services, Renee Edwards, is going to say a few words. And we're a little ahead, Renee, so you have some more time. So buenos días de Dios, Renee, and thank you for stepping in for Dr. Bowen. Folks, Renee Edwards.
Good morning, everyone. It's a pleasure to be here, and I know that you all will solve the problems today, or at least begin to unpack, where we're starting and where we need to go. As a colleague in behavioral health, I come from the provider side. I've been on the provider side for about 20 years, and most recently have worked under Dr. Bowen at BHSD. So it's a pleasure to be here and be here with all of you. So with our presentations, and before we speak at BHSD, we always start off with a land acknowledgement. And so on behalf of all of my colleagues at the Human Services Department, we humbly acknowledge that we are on the unceded ancestral lands of the original peoples of the Apache, Diné, and Pueblo past, present, and future. With gratitude, we pay our respects to the land, the people, and all the communities that contribute to what today is known as the state of New Mexico. So as you explore the topic of cannabis use in New Mexico and any implications on the physical health and behavioral health sides, there are a few key moments in our state history that are worth looking at as you go into your discussion today. As many of you know, in 2007, New Mexico became the 12th state in our union to allow medical cannabis with the Lynn and Aaron Compassionate Use Act, also known as Senate Bill 523. Currently, now there are more than 30 states that have medical cannabis programs. The purpose of the act is to allow the beneficial use of medical cannabis in a regulated system for alleviating symptoms that are caused by debilitating medical conditions and their medical treatments. In 2019, program enrollment overall was over 78,000 participants for behavioral health conditions. Then in April 2019, Governor Michelle Lujan Grisham signed into law Senate Bill 406, which was the first major change to this act since 2007. The bill included reforms to allow the medical use of cannabis in public schools, protect medical cannabis patients from losing custody of their children, provide employment protections for patients in a non-safety sensitive work environment, allow patients to renew their medical cannabis card every 3 years instead of every 1 year, allow the consumption of medical cannabis at dispensaries, and prevent denial of organ transplants due to being a medical cannabis patient. Then just a couple of months later, in June 2019, the governor announced the formation of the Cannabis Legalization Work Group to determine the best path forward for legalization during the 2020 legislative session. The working group was about 20 individuals with different backgrounds, including state lawmakers, cabinet secretaries, law enforcement officials, and medical cannabis executives. The working group released a report a few months later in October 2019 with about 200 pages or more of public comment. Then in April 2021, the Cannabis Regulation Act was signed into law by Governor Grisham. It passed the House 38-32, the Senate 22-15, during a special session called by the governor after the legislature failed to legalize cannabis in 2021. So now here we are, 99 years after New Mexico banned the cultivation, importation, and the sale of cannabis in 1923. We see the first sale of recreational cannabis on New Mexico land on April 1st this year. In fact, the governor visited a dispensary to mark the occasion. And so now we are all here wondering, how does this show up for our members in behavioral health? How do we reconcile the difference that we've been trained in substance use disorder treatment to treat that, and now it's coming up as a medicine. So I hope that you all have a day that is fruitful and promising and helps you understand and gather the knowledge that we need to move forward to treat people in a manner that recognizes what we have allowed here in New Mexico, but how to shore up the difference. So thank you for inviting me to be here.
Thank you, Renee.